right, we are gonna go through this Herbst placement. As promised with the last case, I wanted to show this. So we use GC Fuji Ortho LC, which is a glass ionomer resin reinforced that's dual cure, so that we can go ahead and place it very easily in each band. And then we just put enough around the band to make sure that it's coated. You can use a micro brush if you want in order to make sure that it's around. But you don't need to fill the band completely. It's just more to clean up, and then it's just gonna be a mess. Again, you've got about a 50 to 60 second working time. We usually do keep this in the refrigerator so it extends it so that we only have to use one tip. So you can see pretty nicely that it's nice and clean. We're gonna go ahead and take that. As I'm doing this, my team is keeping the tooth dry. So over in the mouth, they are using an air water syringe and a saliva ejector to keep that upper right first molar nice and dry. As I'm placing the cement, then what happens is I move over, they move out, I move in, and I insert the band. We're starting with the upper right because it's just nice on the patient. It's easy. I've already pre-fit these bands to make sure that they're doing okay. Now from here, I'm just going to take a 2x2 and wipe off the additional cement. You can use a bite stick, or you can even use a plugger to get that seated. A lot of times I'll use a cotton roll to get rid of the rest of the glue. Have the patient bite this down, take my finger, make sure that there's no ridges of glue, and then just hit this with the light. Remember, Fuji Ortho LC is dual cure, so I'm going to get some cure with that light just to hold it, but total cure takes about 6 minutes, which is great because a Herbst is going to take a while to put in. We go ahead and we do the exact same thing on the patient's left side. Same process. You can see that it's a little bit quicker, even though it's not. Once we get that done, if we're taking our time, you can go ahead and load a new tip for the glue, but we usually get this done in about 1.5 to 2 minutes, so we use one tip. The patient is going to open up. They're going to go ahead and dry out the lower, make sure it's nice and clean. I'm loading the lower Herbst now. I've got it flipped over in my hand, and I'm loading those bands, and then I just insert it gently. This usually creates some saliva because this band cement doesn't taste good, so I'm going to quickly try to get this cleaned off so it doesn't have any sort of issue with the patient. Now from here, we're going to go ahead and seat that band nicely. Use a cotton roll to clean it up, and then take the bite stick and have them gently bite on the buccal surface just to seat that band beautifully. And remember, from here, these are fit so nicely. We're gonna go ahead and use the light after we clean it up. If you do get a little bit of adhesive in the tube, just use your air water syringe and use your air to blow out the tubes before you light it up. Because if you light the glue or it cures inside a tube, it's really, really difficult to get it cleaned. But a little bit of air can really go a long way. So we're gonna go ahead and cure this a little bit. Now from here, we're gonna go ahead and rinse the patient out. And I'm a big fan of letting this set up for about 5 or 6 minutes before I do anything. So I just gently take a scaler, remove some of the extra flash, make sure it looks good. We don't want our patients leaving with just junk everywhere, right? The dentist will get a hold of that and then just have a field day. So while you're waiting for it to set up, clean it up nicely, make sure things look good. You can cure it about 2 to 3 times each band if you want to get working on it quickly. A lot of times what I'll do is I'll just have the patient just relax. They can go brush their teeth if they want in order to get rid of the bad taste. And by the time they come back, the band cement's fully cured. A nice trick is to take a little bit of the band cement and put it on the working table so that you can see when it's fully cured without any light. Again, it's about 6 minutes. From here, we're gonna go ahead and that's when we place the pistons. So you wanna make sure that's fully cured before you place the pistons. Otherwise, as you're placing those pistons, you can have an issue. So if we look at this nicely, you can see that the band looks quite nice. It's very cleaned up. It's not obtrusive. The patient isn't really kind of uncomfortable, and it looks really, really nice. And again, this whole process in our clinic takes about 5 minutes if we're not recording it. So now you can see here, we can rinse this out, really make sure that you get the lips closed, otherwise they'll spit all over the place. Let them spit it through a saliva ejector, and the Herbst is cemented. Now you can go ahead and put in your pistons. So if you want to check out more of this, please check us out at ultimateorthacademy.com. Follow our socials. Again, try to put out a lot of great information. Thanks for watching, and take care. Bye-bye.